Hello and welcome to your daily COVID-19 update for today, Wednesday, February 16, 2022.
Self-testing is a way for a person who is at home to know whether or not they have COVID. Right now in Guyana, we're introducing that, and there are some people who would buy the kits and would follow the guidance. But it's not widespread, and therefore we don't see a big challenge. Now, with self-testing, it's a way of just, if you have any concern, to check to see whether you're positive or negative. So, first of all, I think not a lot of people would be doing it, and those who would be doing it, I think they would be responsible enough if they test positive to report it to our surveillance system. When that report is made, we will then determine whether we need to do a second test or not. But at that point, that determination would be made. Self-testing is a concept that you have in different countries. Our travel requirements are very explicit. We are accepting an antigen test from a reputable institution where it's done, or a PCR test. There is something now called a rapid PCR, and we are also accepting that. Somebody having a home kit and doing a test at home does not necessarily qualify or meet the requirements of travel. No country right now is accepting anybody who has tested themselves at home for travel. And we are not changing our guidelines to accept that. Over the last 24 hours, we had 105 cases. And right now we have 1,277 active cases. So if we compare from yesterday to today, you would have seen a significant drop, because we moved from about 1,500 right down to about 1,200 now. So as we have predicted, there will be a lot more people who would be discharged because they would have been in isolation for more than 7 days, so they're now being discharged. Hospitalization right now, we have 76 patients. We have 59 of them at the Ocean View Hospital, with 8 of those persons in the ICU. So we have seen a reduction in ICU cases, but we do have persons coming into the hospital because they have difficulty breathing. And unfortunately, many of these persons, they have not taken their vaccines. So we're seeing a combination of factors. One, persons are older. Two, they have comorbidities. Not just one, sometimes more than one comorbidity. And we also have the case where most of them are unvaccinated. In terms of vaccination numbers, first dose, we are at 429,287. That's first dose adult. That's about 83.7% of our adult population. Second dose, we are at 323,031 doses that were administered. So that's about 63% of our adult population. Again, we have had some challenges with the 12 to 17 age group. So right now we have 33,217 doses that were administered. That's about 45.5% of that age cohort. And we had 23,840 doses, second doses, So that's about 32.7% of that age cohort. Booster doses, we have seen a gradual improvement, but we still need to get more people on booster doses. So right now we're at 47,189 booster doses that have been administered.
You have been watching the daily COVID-19 update for today, Wednesday, February 16, 2022. I'm Natasha Smith-Thomas. Goodbye.